Hi, ladies. We're going to do our Chapter 6 lecture now. We're just going to go through our Google Slides, so I'm going to go ahead and share our screen. All right, let's get you down, and here we go. All right. Chapter-specific guidelines, ICD-10, 11 through 14. This is our Chapter 6 in our book, but it's chapters 11 and 14 in our ICD-10. So diseases of digestive system, chapter 11. Digestive system is chapter 11. It's K00 through K95. For example, an unspecified GI hemorrhage is K92.2. Combination codes with the hemorrhage, for example, K57.21, diverticulitis of large intestines with perforation and abscess with bleeding. So here you have your hemorrhage actually included with your diverticulitis. That's what a combination code is. It's different things that are combined into one code. Okay, so the categories are sequenced in a manner that follows the path of the digestive system from the mouth to the anus, beginning with the disorders of the teeth, because our teeth are in our mouth. For a hemorrhage to be reported active, bleeding is not necessary. However, documentation must support the fact that the active bleeding has occurred. So, hemorrhage does not actually mean that you're bleeding for your medical report. It can be that you were hemorrhaging. So that's an important little tidbit there. So, okay, coders, let's code. Here's our scenario. Abdominal pain. Chief complaint. My stomach hurts and I feel full of gas. Well, here's our history. 47-year-old male with mid-abdominal epigastric pain. So you see that's in red. So we're going to need to remember that, right? Associated with severe nausea and vomiting, unable to keep down any food or liquid. Pain has become severe and constant. He's had an estimated 13-pound weight loss over the past month. Patient reports eating 12 sausages at the Sunday church breakfast 5 days ago, which he believes initiated these symptoms. Patient admits to a history of alcohol dependence, consuming 5 to 6 beers per day, now down from 10 to 12 per day 6 months ago. States that he has nausea and vomiting, or nausea and sweating with the shakes when he does not drink. Okay, so I'm going to point out the two red, epigastric pain and history of alcohol dependence. So how are we actually going to code those? I don't remember what I have here. How would you actually code those? So I'm actually going to just pick up my ICD-10. I did not plan on doing this, but I'm going to do it now. So I'm going to go to pain in my index for epigastric pain. So let's see what we find when we go to pain in our alphabetic index. So pain, found it. And I found epigastric pain, R10.13. So that's what I would say was my first thing, find it again, 10.13. Okay, and so we have a history of alcohol dependence. Okay, well, I want to look at the word history. Well, I don't agree that it's history because he's still consuming 5 to 6 beers a day now. So he has alcohol dependence. So I'm going to go to dependence. Dependence, alcohol. Okay, so I have a little bit of a question for you. Here's what I'm going to say. Okay, so He states that he has nausea and sweating with the shakes when he does not drink. But he's still doing 5 to 6 beers per day. So to me, that's active dependence. That's not even withdrawals. He's still within the dependency. So I'm not going to code with withdrawal. I'm going to code alcohol dependency. I think F 10.20. So let's see what we've got on our next slide. Okay, so I don't know what I have there. All right, let's here's our answers. So this is the answers for okay, what did I do? Apparently I did a little test, but I don't have the other slide. Let's go ahead and go to this one. Let's see. Well, guys, let's just stop here. I want you to code it, and then after the slideshow, put what you think. I think it's going to be R1013 for our epigastric pain, and I would code F10.20 for our alcohol dependence. Also, I mean, I'm thinking that we could possibly do weight loss, but I don't think so. I think those are the two things that we're going to actually do. So you tell me what you think, and we're just going to skip through these next slides. I'm sorry I didn't notice that was messed up before I went into it. I'm going to have to fix that. I apologize though. Okay, so now we're going to talk about chapter 12 in our ICD-10, diseases of the skin and subcutaneous tissue. So L00 through L99 also codes to report conditions of the nails, the sweat glands, the hair follicles. Code the following conditions according to the ICD-10 coding conventions and guidelines. Okay, so I would like for you to pause the video, and I would like for you to code these scenarios. Okay, so once you pause and you code these, I want you to write your answer beside, and then the next slide is going to be your answers. Okay, so you can check your answers, but please do that because the more practice you have, the better you're going to get at these things. But that's some practice in the skin and tissues. Okay, Susie has a distinctive birthmark on her face that she is not fond of. To make matters worse, she woke up on her 40th birthday feeling like she was in her prime until she looked in the mirror and saw the acne that had formed sometime during the night. It brought back memories of her awkward teenage years. Susie made a call to her dermatologist, dreading to deal with these issues as an adult. So there are, well, again, I don't. So it's not going to be this congenital non-neoplastic nevus. I don't know what that is. Uh-oh. Let's go back. It's going to be the acne unspecified, L70.9. Again, I apologize for the mistake on that slide. Chapter 12 describes diseases or conditions of the integumentary system. Does the integumentary system only include the skin? No, it doesn't. What else is included in the integumentary system? Glands, nails, hair, and hair follicles. What are the two glands that are covered in the integumentary system? The sweat and the sebaceous glands. Infections. Using additional code before L00 directs coder to report the infection with the B95 through B97. If there isn't a combination code to describe the diagnosis, cellulitis and cause, staph infection, then both of these diagnoses would be coded out to fully describe the condition. Let's talk about pressure ulcers. Okay, stage 1 of a pressure ulcer is a erythema, redness of skin. Stage 2 is partial loss of skin, epidermis or dermis. Stage 3, full thickness, loss of skin up to but not through fascia. Stage 4, full thickness loss, extensive destruction, and necrosis. Pressure ulcers develop when the circulation is decreased to that area of the body. Pressure ulcers are graded by reported based on depth of the ulcer and categorized in stages, and we just saw those stages. Now we're going to go into chapter 13, musculoskeletal system and connective tissue. M00 through M99, most codes specify site, location on the body, laterality, which means right, left, unilateral, or bilateral. Some codes include multiple sites, such as M15, which is polyosteoarthritis, including multiple sites. Chapter 13 describes diseases or conditions of the bone, joints, and muscles. A medical dictionary will always be a handy tool to use when there are medical terms that you may not know. For example, dorsopathies. Infectious arthropathies, M00 through M02. Direct infections, invades synovial tissue, invades the joint. Invasive organism has been identified. Indirect infections, reactive, microbial infection identified but not in the joint. Post-infective, microbial antigen present but not constant and no evidence of multiplication. Pathological fractures, also known as spontaneous fractures. Fracture reported in addition to underlying condition responsible for the fracture. Never assign a code for a traumatic fracture and pathological fracture of the same bone. Seventh character indicates treatment plans such as A for initial. This is where those seventh characters are going to come in real handy, and you're going to need to remember what we learned. The seventh character A, initial encounter, is assigned as long as the patient is receiving active treatment for the fracture, or other seventh characters. D is subsequent. It's assigned when all active treatment is completed. G, K, and P are assigned subsequent non-routine encounters, and S is assigned for sequela. So let's talk about osteoporosis, M80 and M81. Systematic condition that affects bones. Fracture sustained with trauma that would not only cause a fracture. Site is not a component of codes. Category M80, osteoporosis with current pathological fracture. Age and other osteoporosis codes. Category M81, osteoporosis without current pathological fracture. Osteoporosis is a systematic condition, meaning all bones of the musculoskeletal system are affected. Okay, that is the end of our little crazy lecture. I'm so sorry that those slides were messed up, guys. I'll have to go back and fix them, but I still hope you gleaned a little bit of practice out of those. Remember, let me know what you think about our coding scenario for epigastric pain and the alcohol dependency. Tell me if you agree. Tell me what you think. Like I said, I'm sorry that there looked like there was a missing slide or two in there, but I don't know why they're missing. So I hope that didn't throw you off, and I hope that I didn't go too fast. Also, I want you to make sure that you use those little scenarios that were in the lecture where you can actually practice. Are you bubbling? Are you highlighting? Are you labeling? Are you reading your guidelines? Are you spending extra time besides the things that I'm assigning you to get to know your ICD-10, to learn? Are you using YouTube? Are you using Google? Are you researching? These are all things that you have to be able to do. All right, well, that's the end of lecture. Remember, tomorrow We have a Zoom Live where we get to code, but remember guys, we're not able to do the entire workbook. So I think today you actually have your workbook, to do. So tomorrow, the ones that you have trouble with, we can circle them, we can run through the answers. We're gonna have to play it by ear and see what we actually need to do to help with any issues with this next part of our workbook. All right, have a good day, and I'll see you tomorrow. Bye-bye.